Did you know that a simple mistake with baking soda could actually put your life in danger? You probably have this common household item sitting in your kitchen right now. But using it wrong could have serious consequences. Today, we're exposing the 10 fatal baking soda mistakes that could cost you your health, or worse. Don't repeat them. 1. Overconsumption of baking soda for heartburn relief. Baking soda, also known as sodium bicarbonate, has been widely used as a natural antacid for relieving heartburn and acid reflux. While it can be effective in small amounts, many people unknowingly consume far more than the recommended dosage. Excessive intake can lead to a dangerous condition called metabolic alkalosis, where your body's pH balance becomes dangerously high. Symptoms of metabolic alkalosis include muscle spasms, nausea, vomiting, and confusion. In severe cases, it can cause coma or death. If you're using baking soda to treat heartburn, it's crucial to stick to recommended amounts and consult a doctor if your symptoms persist. 2. Mixing baking soda with acidic cleaners. One of the common cleaning hacks involves mixing baking soda with vinegar or lemon juice to create a powerful cleaning solution. While this may seem effective, you should avoid this mistake at all costs. Mixing an acid, like vinegar or lemon juice, with a base, like baking soda, produces carbon dioxide gas. This reaction is rapid and can result in dangerous pressure buildup in closed containers. In some cases, it can lead to explosions, causing injury from flying shards or toxic exposure if the mixture contains other chemicals. If you're cleaning with these substances, it's better to use them separately rather than mixing them. 3. Inhalation of baking soda. Baking soda may seem like a benign substance, but inhaling it can be dangerous. When people use it as a cleaning agent, a scrubbing powder, or even for DIY beauty hacks, they often stir up fine particles that can be easily inhaled. Inhalation of baking soda can irritate your lungs and lead to respiratory issues like coughing, difficulty breathing, or wheezing. Those with pre-existing respiratory conditions, such as asthma or chronic obstructive pulmonary disease, COPD, are at higher risk of severe complications. Always ensure proper ventilation when using baking soda for cleaning, and consider wearing a mask to avoid accidental inhalation. 4. Excessive use in DIY toothpaste. Baking soda is often praised as a natural alternative to commercial toothpaste due to its ability to remove plaque and stains. However, using baking soda excessively on your teeth can lead to enamel erosion. Baking soda is an abrasive substance, and, over time, it can wear down the protective layer of your teeth, leading to tooth sensitivity and an increased risk of cavities. Furthermore, enamel doesn't regenerate, so the damage done by abrasive materials like baking soda is permanent. If you're considering using baking soda as toothpaste, limit its use to once or twice a week and avoid aggressive brushing. 5. Baking soda as a detox treatment. In recent years, some alternative health proponents have suggested that baking soda can detoxify the body when consumed in large quantities. This is a dangerous myth. The body has its own detoxification mechanisms, primarily through the liver and kidneys, and excess baking soda can disrupt these processes. Taking large doses of baking soda in an attempt to detox can lead to electrolyte imbalances and kidney damage. High sodium levels from excessive consumption can cause dehydration, hypertension, and even heart failure in extreme cases. Instead of relying on risky detox treatments, focus on maintaining a healthy lifestyle that supports your body's natural detox systems. 6. Using baking soda for poisoning or overdose. Some people mistakenly believe that baking soda can be used to counteract poisoning or drug overdose due to its alkaline nature. However, administering baking soda in such situations can make things worse rather than better. For example, baking soda is sometimes used in an attempt to neutralize the stomach acid of someone who has overdosed on acidic substances. But this can delay necessary medical treatment and may even cause gastric rupture due to excessive gas production. In situations involving poisoning or overdose, seek professional medical attention immediately rather than trying home remedies. 7. Applying baking soda on open wounds. Baking soda is sometimes used as a home remedy to relieve skin irritations like insect bites or rashes, but applying it to open wounds can lead to serious complications. Baking soda can disrupt the natural pH balance of the skin and interfere with the wound healing process. The alkalinity of baking soda can slow down cell regeneration, potentially increasing the risk of infection. In addition, the abrasive texture can cause further irritation and damage to the wound. If you're dealing with cuts or open sores, it's best to avoid baking soda altogether and opt for medically approved treatments. 8. Excessive use as a deodorant. Baking soda is often recommended as a natural deodorant because it neutralizes odors. However, many people who switch to using baking soda as a deodorant find that it causes severe irritation. The high alkalinity of baking soda can disrupt the natural pH balance of your skin, particularly in sensitive areas, like the underarms. This can lead to rashes, redness, and burning sensations. In extreme cases, prolonged use of baking soda as a deodorant can cause lasting skin damage. If you experience irritation, it's important to stop using baking soda and explore gentler, skin-friendly alternatives. 9. Combining baking soda with certain medications. Many people are unaware that baking soda can interact negatively with certain medications. Because it's an alkaline substance, baking soda can alter the way your stomach absorbs medications, potentially making them less effective. For example, people who take medications for high blood pressure or heart disease may experience reduced efficacy if they regularly consume baking soda. Additionally, baking soda can lead to increased sodium levels in the body, which can worsen conditions like hypertension or edema, swelling due to fluid retention. Always consult with a healthcare provider before using baking soda, especially if you're taking prescription medications. 10. Using baking soda for infant care. Some parents resort to baking soda baths to soothe diaper rashes or skin irritations in infants. While this may seem like a natural remedy, it can actually be harmful to your baby. Infants have delicate skin, and their bodies are more sensitive to pH changes than adults. The use of baking soda can disrupt the protective acid mantle of a baby's skin, making them more vulnerable to infections and rashes. Furthermore, infants may accidentally ingest baking soda during baths, which can lead to serious electrolyte imbalances and other health issues. It's always safer to use pediatrician-recommended products when caring for a baby's skin.